when you go into that phase of life where you're thinking about starting a family, you kind of automatically think, okay, well, we're just going to do the damn thing and it's going to work.
Mm-hmm.
And you're not mentally or like physically prepared for any other outcome other than like what you're trying to achieve, which
Yeah.
is get pregnant and have a baby. And so when we did that and we're doing that naturally and trying for, I'd say it was probably like 5 months and just nothing was happening. It was like, okay, like, is there something deeper going on?
Mm-hmm.
Like, and again, there's not a whole lot of, unless you're looking for it, like education around what the next step is. And so, I brought it up to my OB at the time, and she was like, well, you can go on Clomid and see if that works. And again, not having really any education on what that was, what it was supposed to do, how it was really supposed to help. And again, just really didn't do anything. We were still in the same spot months later. And at the time, you had the period fix, which was a course
Oh
and
my
like a coaching.
so nostalgic.
You were like just starting out like in this like
I'm like embarrassed
coaching.
thinking about that.
No,
I
it
turning
was
red.
no, but it was so good. Like so
It was
good. I feel like I learned so much about even just my cycle. Like regardless of
good.
trying to get pregnant,
Yeah.
like there was so much lack of education around menstruating and my cycle and how I should be like treating my body or how I could support my body during like different phases.
Mm-hmm.
Um, I didn't know any of that. So that was huge. That was like the first kind of step into the HHC world, which I don't even, was holistic a thing yet?
Yeah, it was holistic health coach.
Okay.
It started
So
as
it's like,
a coaching practice, and that was the first program that I launched.
yeah.
Which, in hindsight, it is a little bit embarrassing, but I feel like that's how you know you started at the right time.
Mm-hmm.
When you look back and you're like, oh my gosh, I can't believe I put out that program. But it was good.
Yeah.
That was the time, too, where I feel like people were starting to talk about their cycles more, and there was a couple books that were making a splash, and people started to talk about cycle syncing and tracking ovulations. Yeah, what a time.
What
I
a
can't
time.
believe that you were in that.
I know.
That was a good experience for me too.
Yeah.
So 5 months in, it seems like you started to more or less think about something else, or something rather might not be lining up.
Yeah. Yeah. And, at the time, like, yes, went through that program, learned a ton. That was like a great introduction to like how holistic healing could potentially like support my cause. But
Yeah.
again, had been talking to the OB at the time. She was saying, well, I think you need to see, an infertility specialist. Like if you've been trying for 6+ months and
Okay.
nothing's happening.
So
And
Clomid for like an additional month or two.
yeah,
And she was like, maybe we should see a specialist.
yeah,
Okay.
yeah. So we did end up doing that. And, the good thing about going that route is you are, they're testing you for everything.
Yeah.
The hard part in our story was that we were both healthy and it was unexplained fertility. Like we didn't really get an answer of why it wasn't working,
Yeah.
which is,
The hardest part.
it's the hardest part.
Journey.
Yeah. And, it's great that you're healthy,
Mm-hmm.
but super frustrating that it feels like there's not really much that you can do.
Yeah.
And I also think, though, that that's very much the difference between the two approaches of going down that route with, like, I don't know, Western medicine,
Yeah.
conventional medicine, and then the route that I ended up taking, which ultimately gave me my miracle baby, was not all of the IVF cycles,
Mm-hmm.
but the change that I made with functional medicine.
Mm-hmm.
And that was like mind, body, soul, spirit, everything.
Yeah.
It wasn't just one thing, and it wasn't medication either, which is the wild part.
I know. That is wild.
Yeah.
So after about a year of trying, when did you get referred to CARS?
So that was about a year in.
A year in.
Yeah. Yep.
And then you said the hardest part was really not knowing, because sometimes if you have data or something that's wrong, it's almost like validating to be like, okay, I can work on this. I have control or some control over this. But if test after test comes back normal, it's like, what's wrong with me?
Yeah.
I'm sure you felt like that.
Yeah. And like, you're still being told, well, there's all these options. We can do IUI, which we did, I think, 4 times, because that's the least invasive option.
Yeah. Did you try IUI?
Yeah, we did 4 times.
Okay.
Yeah, so like 4 consecutive months.
Okay.
Nothing.
Yeah. And you're tracking, you're doing labs and all of that.
Yep, because they're having you come in at like a very specific time every month to do it.
Okay.
And yeah, so that didn't work. And then obviously the next step was, okay, like let's actually do an IVF cycle.
Yeah.
And see where that goes.
Yeah.
And we ended up doing 3 full cycles, because in the first they were only able, I think it was only like 1 or 2 eggs. Like it was very little. Like they were really surprised at how many they were actually able to retrieve.
Yeah.
And then neither of them turned into an embryo. So it was like that whole thing was like a wash.
Like, yeah.
Yeah, like
waste of effort and time, and everything is so incredibly expensive too. Not only financially, just like emotionally and
yep. You know, you're on
physically,
and it's just a lot.
It's a lot.
A woman to go through that.
Yeah.
But nevertheless, like we were like, we're gonna try it again.
Yeah.
The second time, we ended up with 1 embryo, but again, transferred, didn't take. So I was like, all right, we're gonna try this 1 more time and see what happens. And we ended up, I think it was with 3 embryos. Transferred the first one, didn't take again. And that's when I was like, all right, before we do this again, before I have 2 more, and I'm not doing another cycle after this, so how can I prep my body to be the most accepting of this next transfer that it's going to work?
Yeah.
And that was really like the beginning of like the real functional medicine work that I did.
So that's when you started to think about preconception and fertility more intentionally from a holistic standpoint.
Yeah, because it was like, if you can't tell me what's wrong with me, then let me just try to figure out what else. Like, you're not looking at it from an energetic standpoint.
Yeah.
You're not really even telling me from a nutritional standpoint, like how I could be supporting, you know, any progress.
Yeah.
So that was a huge part of it, was like, what can I be eating?
Yeah.
What supplements should I be taking?
You started to ask some bigger, broader questions.
Yeah.
What you can control.
Right. Like, could this be gut health related?
Isn't it so wild, though, that none of that is really discussed? I don't know, because I don't have experience with...
In my experience, it was not.
Yeah. It's like, what are you eating? How are you sleeping?
Yeah.
What do you do for work? None of that is really discussed. Because what if, like, I'm not saying you are, because you're not, but what if you were eating just, like, I don't even know.
Yeah.
Like, I was thinking, like, Captain Crunch for breakfast.
Yeah, no.
or, like, something.
No, I didn't do that till I was 8 months pregnant and was like, I just really want some crappy cereal right now.
Yeah. But that's a thing, though, because that can put stress in the body, then you have lack of nutrients, and et cetera, et cetera. It spirals from there.
It does.
I want to go back, though, because you said something early on that kind of caught my attention. You said something like you went into preconception around, like, or having the idea, rather, that you were, like, not expecting a different outcome than just, like, having a baby. Because I feel like now is maybe, how old is Ella?
She's 4.5.
Okay, I was going to say 5.
Yeah.
Even within, like, the past 5 years, I feel like as a culture or society, we're talking more about this versus, like, we really weren't 5 years ago even. but you went into it feeling like there wouldn't be any other outcome than just like having a baby. You're healthy, you guys are young, and that was the next obvious step for you guys. I think for me it was the opposite because I cared for you, worked with women in the period fix that had issues with fertility and PCOS and ovulation. So I was so scared. And I'm 36 next month. So for me to start a family now, in my mind, I convinced myself that it was going to be a challenge. Yeah. And that's why I think, too, I didn't necessarily want to talk about it at first because I was like, I almost did have like a sense of not you saw me like raw and real, so like you're a bad judge, but like for everybody else, you know me in a way that like not many people do, but like I almost didn't want to say anything because I had this like, I don't want to say guilt because that sounds too aggressive, but a shade of guilt, and then also like a fear around, well, what if this doesn't work out? Like, what if this doesn't stick?
Yeah.
Until I'm like in my third trimester, and then people see me and they're like, "Holy shit!"
Yeah.
Like, are you pregnant? I'm like, "Yeah, I guess I am." Turns out this worked out. So it's just weird to have that. I don't know, experience that's so opposite, but at the same time feeling a lot of the same feelings.
Same feelings, yeah.
In a different way.
Yep, for sure. For sure. I mean, I think that reigns true for a lot of women. Like, it especially, obvious, well, I don't want to say if you want it,
Yeah.
but it is nerve-wracking. Like, you're going to all these appointments, and there's constantly checkups, and you're like, okay, I just want to make sure that they're okay.
Yeah.
And, you know, I think I was like 12 weeks before we even told, like, our parents.
Yeah.
Because I was just so nervous.
Yeah.
That because we had miscarried before, but it was very, very, very early on. And I think I didn't even mention that before, but that was part of our journey, was that prior to IVF, I did get pregnant naturally and miscarried, and that was kind of the catalyst for, like, even going to a specialist. But because of that experience, I think when we did get pregnant, obviously we were happy, but you couldn't have that, like, same excitement of like, oh, it's a positive pregnancy test, because it just, all you feel is fear.
Yeah.
That might not stay.
I felt that.
Yeah.
But almost like, too, I didn't want to make it a big deal.
Yeah.
Like, I was just like, yeah, it's positive, but we'll see. We'll see where this goes.
And here we are.
Yeah. And then, like, a bunch of other emotions rolled in, though. All in one. It's like, one minute you're happy, the next you're like, who did this to me?
Yeah. Nervous.
Yeah.
Excited.
Yeah. All the things.
Scared. Happy. All the things. Yeah.
So, after you were referred, you started to do IUI cycles, and then shortly after that, you started IVF. And then, was it concurrently that you were working with our team, or was it sounded like you might have taken a break before your next transfer or something like that?
So I think they, were like, we're ready to go and transfer another one. I think you either have to, like, wait. I think you have to wait a month in between.
Yeah.
Because this was the first time that I ever had more than one embryo to actually, like, try again. And so I was like, don't even put me on the schedule, because I am not going to go through this again.
Ready.
Yeah, unless I know that I'm doing everything else that I could be doing to have a different outcome. And like I said, it was a lot of nutrition, supplements, energy work. So I did EFT, which really uncovered a lot of trauma and released a lot of trauma, which I really think was, like, just one of the biggest things that helped me.
Yeah. That's sort of my question. Like, what was the most surprising part about your functional medicine journey to support your fertility?
Well, I think even just the education around what I could be eating and taking, number one,
Mm-hmm.
because there are like certain
There
foods and meals and
Yeah.
and different supplements because you need different,
Nutrients at
nutrients,
certain
minerals.
times.
Yeah.
Yeah.
That was huge. I was like, I was never told this by my OB,
Yeah.
a specialist. Like, no one was putting me on any kind of regimen
Yeah.
to set me up for success.
Yeah.
Like maybe if I had something wrong, whether it was my thyroid or if it was his whatever,
Yeah.
they would have put me on, I would have had a plan.
Yeah.
But because it was unexplained, they didn't put me on any type of plan or regimen. So I think that was huge to know that there are things out there that you could just be doing in your day-to-day life, especially if you're thinking about having a family.
Yeah.
And in that preconception phase, like, you don't have to just like jump into it and like cross your fingers and hope
Yeah.
it works out. Like, there are ways to support it.
Set yourself up
And I just,
for a better outcome,
yeah.
eventually. Yeah.
And I just had no idea that that was even a thing.
I feel like that's something that is applied to functional medicine across the board, is that you just have so much more control than you were led to believe with your nutrition, with your sleep, with your stress management, all of that. I often talk to my clients about the Nurses' Health Study. Is that something that you remember?
I
don't know if
I do.
that was something that was discussed, but it's essentially a study on a cohort of nurses that were manipulating their diet to support their fertility, I want to say. And we found that there was like hardcore things that you can do with food that can support your ovulation, and things that can get in the way of it too. So like getting your protein right, and it's very specific. It's like Goldilocks. Too much can be a problem. Not enough can obviously be problematic. And then I think in that study, if I'm remembering correctly, that dairy was found to be supportive. And I think that probably, this is just me kind of speaking off of, again, what I can remember, but it's probably related to, because Dr. Kate says this too, that you need more fat in the diet.
Yes.
So like full fat, dairy,
everything. It was like
support
bacon.
hormone health.
I'm like, you want to tell me to eat steak and bacon every day? That sounds
Yeah,
great.
sounds amazing. Yeah, seriously. Well, that was something when we had Dr. Kate on last season. She talked about fat and how that often makes people feel, especially our age, because we grew up in the low fat era, and like fat free. It's a totally different mindset shift around food. So, and then also we grew up in like the almond milk phase, or like that was kind of like an oat milk right now. It's like having a almond, it's just like terrible for you. But yeah, it's a weird flip on nutrition when you've been eating a certain like low fat, low cal way. So I think a lot of women struggle with fueling appropriately and eating enough protein and eating enough fat in the diet. Because if you don't have enough fat in the diet, you don't have enough cholesterol, and hormones are really built from cholesterol, if you can recall that hierarchy of hormones. So yeah, that's cool to hear. That you got back on a nutrition plan and started some supplements. What are the supplements that you had in?
Oh gosh, this was so long ago. I don't know if I remember.
Well, obviously, like a really good prenatal DHA, which is a fat, and I would say like much more than what people probably take, or even sometimes I see like prenatals with DHA, and it's like, no, don't do that. Separate them out.
I want to say that
choline.
And this is all coming back to me as you're saying.
Antioxidants, and a lot of this applies to men too, which sounds strange, but men take that prenatal. It can just cover your bases and put you in a better position.
All of the things that they definitely don't teach you this in health class.
No, I know. Well, I didn't know that I remember when I learned about, and I don't think this was even something that I learned in nursing school. It was more just like self-inquiry and reading and doing my own research, but come to find out there's multiple phases of your cycle, and you can only get pregnant like 6 days, 5 days out of the month when they're scared the living hell out of you around like getting pregnant. And come to find out it's kind of hard.
And it's kind of hard.
There's a lot of variables, and you have to line them up correctly. I mean, I know that for some women it's not that difficult, but it's a science experiment. You have to keep track of all your variables.
Yes, you do. And again, I mean, people are talking about it much more
now
than they were 5, 6 years ago when we had
well, there's devices too, the Oura Ring and the Whoop and things like that. But
that like
even 5 years ago, that wasn't a thing. And basal body tracking was like hardcore. Like people were not doing that, checking temps and confirming ovulation and all of that.
Yeah, I think I was having to when we were going through IVF. Like they'd obviously have to know when you were like ovulating, and I was peeing on an ovulation stick.
You
like
were doing LH testing.
Like it wasn't anything as special and advanced as it is now.
Now with the Oura Ring, I know exactly. Well, I'm not wearing it right now because it drives me nuts now that it's happened. But I knew like to the day when I would ovulate, and it was
maybe that also helped.
I don't want to say definitely, but I would say for sure.
Timing wise.
Timing wise. Yeah. So, tell me more about your experience with functional medicine and how that related to. Did you end up going back to your next cycle, or what happened through that experience?
Well, it was like 2, maybe 3 weeks after I had started the functional medicine regimen, and it was about like 2 weeks into doing EFT tapping and
to release trauma, have more of a focus and control over stress management.
And which was great because now I can do it on myself. Like when I'm starting to feel anxious, stressed, it's such a nice tool to have and like can carry through life and all of the other phases of life that I'll go through.
Can we stay there for a second? Because I have an idea of it, but I don't necessarily understand it fully. Let me tell you what I know, and then you can fill in the blanks. So it's emotional freedom technique, EFT, and the intention is that you tap in certain places, right? And you're supposed to say out loud, is it the negative trauma or is it a positive flip on the trauma?
It was, for me, a positive flip on the trauma.
Okay.
So, like, because my trauma made me feel a lot of shame, and so it was flipping it to make it, like, not shameful.
Don't share what it was, but can you give us, like, an example of what that could be? My trauma is my parents like my sister better. I'm kidding, they don't anymore, but they did. She was just a better kid. I was not a good kid.
You're the typical second child.
So, like, my parents love me the same. My parents love me the same. My parents love me the same. My parents love me the same.
Exactly.
I feel like if you do that enough, that would, I don't even know, that would destroy me.
every, like, cycle that you're doing that, you do go through it multiple times. And so before you do the tapping, you kind of recall the trauma, and you give it, like, a 0 to 10, like, emotion, like, feeling that you get. So 10 being, like, I'm hysterical. And, like, can't even tell you, like, recall this story. And then 0 obviously being, like, I feel very, like, neutral around it. And you basically tap, and you keep tapping, and you keep tapping until eventually you can talk about this trauma and feel totally neutral. And for me, I mean, I won't go into detail, but I'm open about it. It was, like, sexual trauma. And so it makes a lot of sense that, like, this part of my body was, like, closed off. It was, like, not accepting of, like, this experience at all. And so in hindsight, I'm like, holy crap. And it happened when I was a child. And so, like, you're just, I don't know. You just, like, go through life, like, not even thinking about it. And
it's you think it's normal when you're a kid. You know, you make stories up, I guess, in your mind to convince you that, like, oh, this is what everybody experiences. I feel like that's something that people don't really, to go back to the EFT and how that relates to nervous system work and really more of a foundational practice to set you up for preconception, is that you have this, and this is what I understand of it. I'm obviously not an expert, but if you have this emotional trauma that's weighing on you all the time, you're going to have potential issues with ovulation. And maybe you're ovulating each time, but your ovulation isn't as strong, so the cycle in general isn't as robust. So it appears that everything is normal, but then when you go to have like an implantation, the lining is not, again, like robust enough to accept it.
Yeah.
So it could be that there's not necessarily an ovulation problem, but more of like a hormonal issue that can be layered, and it's never one thing. My clients hear me say that all the time, but hypothetically I can understand if you're working on releasing trauma and nervous system work, that's going to transform potentially your ovulation, and you can have a stronger ovulation with better hormonal response.
Yeah. And I mean, this is the crazy thing, is so 3 weeks into this, we're on vacation, and I haven't gotten my period. And I'm like, is this for real? Like I'm taking tests, and it's saying negative, but I'm late. And so I
it's like my stress.
I'm like, is this something?
Sometimes even just like travel can be a stress in the system.
Sure.
That will delay an ovulation and push out your period. Which can be, you know, somewhat normal.
Right. And I had called up Dr. Kate, and I was like, listen,
this is happening.
I haven't gotten my period. And she was like, I just have a really good feeling about this. She was like, when you get back, call the specialist, because at that point, like, I still have to go like through them for testing and all of that. So,
but you're testing at home. You're doing on your trip. You'd
have to get a blood, blood test, because again, the when I was peeing on a stick, it was just, it kept saying negative, but I didn't have my period. And I'm very, like, regular. Like, I've pretty much always been regular. I think really what drew me to the period fix was, like, I saw a post that was like, you don't have to be in pain during your period. I'm like, I need to learn how to do that. Because that was the problem for me. It wasn't really about being regular. But, so it was just very strange that this was happening. And so when we got back to Connecticut, went to the specialist, they did the blood test, confirmed that it was positive. So this happened naturally. This was not through IVF. Like, this was, seriously. I'm like, can I get the, like, 20 grand back? And it was just wild how fast that it worked after having done all of those other steps with functional medicine. And it was interesting, too, because I remember getting the call from, the nurse at the center, and them being like, well, it is positive, but, like, basically saying, like, don't get too excited, because your HCG level is, like, lower than we'd like to see it. And blah, blah, blah. And, then I called up Dr. Kate, and I'm like, it's positive, but, like, this is what they said. And I'm, like, kind of freaking out. And she was like, relax your mind. It's all going to be great. Like, this is just as much about, like, mindset as it is, like, everything else. And so, it was also just, it was nice to have, like, another advocate. Other than just the, the specialist. And somebody to, like, keep me, like, staying positive about it. Because, again, like, the second time after you've gone through all this and you've had a miscarriage, like, you're instantly just nervous and scared. Like, it's very hard to be happy and excited about it. And so that was real. Like, I really appreciate her for being that person for me.
I would say that's, like, a huge part of what we do. Is being I guess the word is liaison between all different types of specialists, and we make sense of what can feel like medical jargon for a lot of people. And kind of putting all the pieces together and having one person to be like, hey, what do you think about this? Or how does this apply? Or whatever it is. And then also just like being that coach. And that's why the membership is so powerful, because
So
it's
great.
not just a one-off visit. It's at least 6 months of building a relationship with somebody and having that person in your back pocket, or just a message away when you need us. And sometimes it is just like you're on the right track, or maybe you're not, and you have that person to be like, okay, let's regroup on this, or let's do this test, or whatever it is.
Yeah. What I love about holistic, like HHC and all the providers here, it's like, it doesn't even matter like who you see. Like, it feels very, like, I don't know if I want to say like family or like friend relationship. It doesn't necessarily feel like patient and provider relationship.
Intentionally.
Like, yes, like I never feel like I'm being like spoken down to, or even like spoken to, like you need to do this. It's always very much a conversation of like, well, this is the data. Like, this is what I, suggest, but if you're not feeling this, let's try this. Or, like, it's just very conversational. On top of just the supportive piece in general. Like, I've never felt so supportive from providers. So, and I can, speak to other members of my family. So this beautiful angel baby that came out of this whole situation,
my patient,
is also now your patient because of her diagnosis. And so it's I don't know, it's kind of beautiful.
It is such a beautiful thing. I feel like I could cry thinking about it. All of my patients have heard me say that. Like, I'm just gonna show up as myself. I'm never wearing a white coat. I'm usually in jeans and Uggs. Like, I'm just who I am, and I have education and training, but you know your body the best. So I'm just here to help you to make that decision, whatever it is that you want to do. And that's exactly how I approach every patient. Is like, this is what I know. This is what the science shows right now. This is emerging data. What are you feeling called to? And I think what is most important in a lot of certain cases, it's like, what is your body telling you to do?
Right.
And sometimes it's what I think, and sometimes it's the opposite. And either way, that's okay. And I'm here to support.
And that's the nice thing too. It's like you're not trying to convince anyone.
I'll never do that.
Don't go.
I say that too. I'll never tell you exactly what to do.
Yeah.
Because that just doesn't work. Because I can make a care plan that's looks beautiful on the outside, but if it doesn't resonate for whatever reason, it's never going to work.
No.
And I think that that's why, and this is also a layered discussion, but that's why conventional medicine fails a lot of people, is because it's one option, it's one pill, and that's not what they want to do, and then they don't feel heard or seen, and then they're stuck.
Absolutely.
And then they don't know where to go from there. So just like having options and having somebody to be like, hey, this is something that you can consider can be so therapeutic in itself.
Yeah, just the conversation alone.
Yeah. That's my goal for the first visit, is just like, hopefully they feel seen and heard, and that they have some hope in terms of like where they could go with this. Maybe I don't have all the right answers, but I know a lot of smart people.
Yeah, you do. You do. And I think like that kind of leads into, I have my daughter who's 4.5 now, and, we went through this whole experience and had her, and then I still had 2 embryos after that. And so no one was saying, no, try naturally again. Like, there was like,
when are you coming back?
Yeah, like, go try another retrieval, see what happens. And I do. I think my body was set up for success, because then that was the first one that ever...
You transferred one?
I transferred one.
And it stuck?
And it stuck.
Amazing.
Yeah, and now I have my second.
That's
beautiful
incredible.
Little baby, yeah.
Oh my gosh.
So, who's going to be 3 in 2 weeks?
That's wild.
Insane. Yeah.
What do you think people assume around IVF in general? I mean, it sounds like you said I think this was off camera, but earlier you were like, you think it's going to get you to that end goal, and maybe it is more or less an insurance policy, but it's not guaranteed.
Yeah, I mean, I think after going through it and again, not every experience is like mine. There's people who
Have
have,
success.
yeah,
Yeah.
like go through one
And like thank
cycle.
God,
Yes,
honestly. Like it is truly
it's
an
life-changing
amazing
work.
opportunity for so many families, and it
Hmm.
has allowed people to bring children into this world, and that's not what this is about by any means.
Hmm.
But just talking more about how there's more variables that you can control and participate in, even alongside that
Right,
process. And
right.
there are supplements, and we talked about the Nurses Health Study that are supported by
Hmm.
science to support those outcomes with IVF, even.
Yeah.